Hi there, thank you so much once again for joining me for pharmacology class. Last day I was taking anti-cancer drugs, and in that particular area I had dealt about what do we mean by anti-cancer drugs, what are the indications for starting anti-cancer drugs, and we had seen the classification of anti-cancer drugs. So continuing with the classification, I had mentioned that anti-cancer drugs, they have been classified mainly into two: drugs that act directly upon the cells, which we call it as the cytotoxic drugs, and we have the second group, drugs altering the hormonal milieu. And last day I had just completed about the cytotoxic drug, in that the first classification was alkylating agents. Under alkylating agents, I had covered the headings, not in detail, but the headings that we have: nitrogen mustards, then we have ethylenamine, and we have alkyl sulfonate, we have nitrous ureas, and we have triazine. So moving forward today, we will go to the second classification in cytotoxic drug. Okay, the second classification is anti-metabolites. Now I just want you to remember, when it comes to anti-metabolites, we are going to use the term antagonist. All right, we're going to use the word antagonist. So the first one, what we have is folate antagonist. Folate antagonist. And under folate antagonist, we use a very well-known drug, methotrexate. Methotrexate. The second one that we be using is purine antagonist. Purine antagonist. In purine antagonist, we have 6-mercaptopurine, 6-thioguanine, azathioprine, and fludarabine. So these 4 drugs we will be coming across it: 6-mercaptopurine, 6-thioguanine, we have azathioprine, and fludarabine. The next one, what we have is pyrimidine antagonist. Under pyrimidine antagonist, we have 5-fluorouracil, we have cytarabine, which we call it as cytosine arabinoside. So these are the 2 drugs under your pyrimidine antagonist. So antimetabolites, we have folate antagonist, we have purine antagonist, and we have pyrimidine antagonist. Moving over to your third classification, we have Vinca alkaloids. Vinca alkaloids. Now I just want you to remember here, Vinca, it starts with the alphabet V. So we have 2 drugs starting with V: vinblastin and vincristin. Vinblastin and vincristin. And I just want you to know that vincristin is also known as the oncovin. Oncovin. The fourth group that we have is taxanes. Taxanes. And we will be using 2 drugs under taxanes: paclitaxel, docetaxel. Paclitaxel, docetaxel. Then we have is epipodophylotoxin. Epipodophylotoxin, under which we have the drug etoposide. Etoposide. Then we'll be using the 6th group, camptothecin analog. Camptothecin analog. In that we'll be using 2 drugs, topotecan and irinotecan. Topotecan and irinotecan. The seventh group we have is antibiotics. We have actinomycin T, or it's otherwise called as the dactinomycin, daunorubicin, doxorubicin. We have metoxantron, bleomycins, mitomycin C. These are the drugs we use under antibiotics. Then we have miscellaneous, the eighth group under cytotoxic drug. So we have hydroxyurea, L-asparaginase, cisplatin, carboplatin, imatinib, and procarbazine. So these are your 8 group category under cytotoxic drugs. Okay, so I repeat the classification that we have under cytotoxic drug: nitrogen mustard, then we have is antimetabolites, vinca alkaloids, taxanes, epiporophyllotoxin, we have the camptothecin analogs, we have antibiotics, and finally we have miscellaneous group of drugs. Coming over to your second main classification of anti-cancer drugs. Under the second classification, the drugs will be involved in altering hormonal milieu. So the main classification is drugs altering hormonal milieu. The first group of category that we have over here is glucocorticoids. Glucocorticoids. And a very common drug that we use is prednisolone. Prednisolone. The second one is estrogens, and for which we use phosphestrol and ethinyl estradiol. Phosphestrol and ethinyl estradiol. The third one what we have is selective estrogen receptor modulators. Selective estrogen receptor modulators, and we have tamoxifen and we have toremifene. Tamoxifen and toremifene. The next group of drugs that we have is selective estrogen receptor down regulators, and we have only one drug under it, fulvestrant. Fulvestrant. Then we have is aromatase inhibitors. We have letrozole and anastrozole and exemestane. Excuse me. So we have 3 drugs here: letromazole, anastrozole, and exemestane. Then we have is anti-androgen. In anti-androgen we have flutamide, bicalutamide. Flutamide and bicalutamide. The 7th group what we have is 5-alpha reductase inhibitor. 5-alpha reductase inhibitor, and we have 2 drugs, finasteride and dutasteride. Finasteride, dutasteride. The 8th group we have is GnRH analogs. Now GnRH means gonadotropin releasing hormone. So we have gonadotropin releasing hormone analogs here. We have nafarelin. We have triptorelin in it. And we have last category under the drugs altering hormone milieu, that is progestins. And under progestins we have hydroxyprogesterone acetate. Hydroxyprogesterone acetate. So we have covered with the classification of anti-cancer drugs. So anti-cancer drugs we have classified basically into drugs that directly act upon the cells or called as a cytotoxic, and the drugs altering the hormonal milieu. Okay, and the drugs altering the hormonal milieu, we have glucocorticoids, we have estrogens, we have selective estrogen receptor modulators, selective estrogen receptor down regulators, we have aromatase inhibitors, we have anti-androgens, we have 5-alpha reductase inhibitor, and we have gonadotropin releasing hormone analogs, and last one we have is progestins. Okay, so in total we have around 17 categories, okay, under anti-cancer drugs. I know it is very, very difficult, but I just want you to focus very well, and I have given you certain tips here and there for you to remember what and which. All right, so it's going to be easy for you. Now we have completed with the classification. Now moving over to the general toxicity of your cytotoxic drugs. So like I said, cytotoxic drugs, they basically act on the cells, okay, but if you see, you can find that they have a very good profound effect upon the multiplying cells. So they target a lot mainly on the multiplying cells, and they begin their action by acting upon the nucleotides or your nucleic acids, which are involved in the formation or which are involved in the cell division. So what they do is they interfere with the cell division process by inhibiting or just changing the nucleotides or the nucleic acids so that the pairing doesn't take place, and as a result the cell division will be disrupted, and that's how they will be directly carrying out their action. Now there are certain toxicities which are associated with it, and we will be seeing which are the parts which are very badly affected. Obviously, since it is the cytotoxic drugs, obviously all the cells will be having an effect in the body. Okay, so the first one that I want to focus on is the bone marrow. The bone marrow is a very important area which is involved in the production of your red blood cells or your RBCs. So keeping those things in mind, okay, you have to ensure that we go for carrying out a very good checkup on their blood test, or a complete blood count should be done should be done during every visit or once we have started with your cytotoxic drugs. Okay, so the bone marrow, when it gets affected, it's going to result in thrombocytopenia. You can find aplastic anemia, you can find agranulocytosis, and even granulocytopenia can be noticed here. And also here the person is very much prone for infection as well as bleeding. So we need to be extra careful when we are administering your cytotoxic drug, especially the blood count. A complete CBC or your complete blood count should be taken or monitored very well, and it's very important to protect your patient from developing any infections. Okay, the second one where it's going to affect is your lympho-reticular tissue. Lympho-reticular tissue. So basically it's going to result in lymphocytopenia. Lymphocytopenia plus the cell-mediated immunity and the humoral immunity will be getting affected here. So there's going to be a very good damage. So if you see, the defense mechanism of the host is very well reduced. Okay, so this particular point you have to keep in your mind. Coming over to your oral cavity. Now oral cavity gets very badly affected. You can find stomatitis, a very common complaint, and even when the patient starts taking food, you can find breaches, okay, and you could find a lot of oral infections taking place. And this oral infection is basically because of neutropenia and because of the suppression of the immunity. All right. Coming over to your gastrointestinal system, and one more thing I remembered, you can find xerostomia in your oral cavity. Xerostomia is otherwise called as the dry mouth. Okay, and this also contributes a lot for dental caries. Coming over to your gastrointestinal tract, the GI tract, you can find the patient complaining of diarrhea. There will be shedding of mucosa, and nausea and vomiting is very common complaints over here. So because of this nausea and vomiting, the patient won't be interested in taking their food in a normal way. Skin. Alopecia will be very common, and at the same time dermatitis. So you need to assure your patient very well, because their self-esteem is going to be affected here because of this particular matter. Then we have an effect on the gonads. When it comes to males, you can find impotence and oligozoospermia. When it comes to female, you have amenorrhea, as well as you have a lot of effects on ovulation. Inhibition of the ovulation can be seen. Okay, and even the germinal cells, they undergo mutagenesis. Coming over to fetus, a very bad impact it will leave upon the fetus. Sometimes they can start with, there will be abortion, sometimes they can go for fetal death, or sometimes it can result in teratogenesis. So these are the common effects you can find when it comes to the fetus. Then is carcinogenicity. Carcinogenicity, like secondary cancers, especially like leukemias, lymphomas, they have a greater frequency to reappear or to come back after many years because of the use of the cytotoxic drugs. Okay, so we call it as a secondary cancers, and this can happen mainly because of the cell-mediated and humoral blocking factors against neoplasia. And the last one that you can find is hyperuricemia. That means a very good increase of uric acid in the body. Now, how uric acid can be found? It's mainly because of the purine metabolism. You have a greater release of uric acid in the body, and the patient, when you do a test, you can find the uric acid levels being elevated. So you can find even gout, and also you can find uric stones in these areas. Okay, so these are the general toxicities that you can find when it comes to your cytotoxic drugs. Okay, but this is a general one that I've told. But when we deal individually with the drugs, we have certain toxicities associated with certain group of drugs. So that I will be covering it up in the next class. I hope you have understood the class. Thank you so much.